This is Anthony Cave, your physician anesthesiologist and integrative medicine specialist. My wife wanted a puppy for like 10 years, and I held back for a long time. But we finally got our puppy. We named her Karma, and boy, has she taught me a lot about medicine that I didn't learn in medical school. Nothing at Stanford or Harvard ever taught me just how much puppies can make surgery and anesthesia safer, for example. Now, I'm an anesthesiologist, so I know that medications that we use during and after surgery can be very strong, and they come with strong side effects. So, how could a puppy help with that? Well, for one, it can help minimize the amount of opioid medications you need. Just look at the opioid epidemic and how much pain medications from after surgery have acted as gateway drugs for that. There's way more to medicine and surgery than pain meds like fentanyl and anxiety medications like Xanax. There's more to the story than what they're usually told at the doctor's office, and you deserve to know about it. Since I practically live in the operating room as an anesthesiologist, this is really important to my patients, and I care about it a lot. Let's talk about it. Hi, I'm Anthony, an engineer turned doctor, and I work in a big legal scam. Corporate-dominated healthcare. Your doctors didn't know what they were getting into, and patients don't get the care they deserve. What patients are told is healthy usually isn't, and when they're told something is unhealthy, they're left without practical solutions. But that's exactly the way the system was built. It profits by making you sick and keeping you sick. Patients are getting played. Elite academia doesn't help when they're not at ground level where the problem starts. Patients aren't statistics. If we want actual change, we need to meet patients in the streets where they live and breathe. It's time to reveal the medical secrets that the system uses against you, and to bridge the gap from elite to street. So, anesthesia is mysterious. We don't really know how it works, but we know that it puts you in a coma. And it takes strong medications to put you in a coma and keep you there, and also to keep you safe. These strong medications have strong side effects as well. It's because under anesthesia, your heart, your lungs, your brain, your kidneys, they all go kind of haywire. We gotta keep you safe. So, how can dogs help keep you safer under anesthesia? Well, it has to do with the fact that we can probably reduce the number of strong medications we need to use when you have a dog nearby. Pretty incredible stuff here. One of the strong medications we use are called opioids. Think Norco, Percocet, fentanyl, Dilaudid, all the things with the opioid epidemic. Well, unfortunately, that opioid epidemic hasn't gotten any better. In fact, it's gotten worse since COVID. What sucks is that surgery can actually contribute to the opioid epidemic. How? In the United States, we prescribe a boatload of opioids after surgery, more than any other country by a huge margin. For example, 91% of US patients get opioids for every 5% everywhere else in the world. Well, it turns out that all it takes is about 5 days of needing pain medications to increase your risk of addiction. And after surgery, you need pain medications like Norco and Percocet. Well, unfortunately, 1 in 4 patients after surgery can actually become at risk of opioid addiction. So you can see how prescribing opioids after surgery can increase your risk of addiction, once again with meds like Norco and Percocet. It's not only opioids. Anti-anxiety medications can have similar effects. Think your Xanax and Ativans. They can also be addicting, and when combined with pain medications after surgery, can also lead to death, just like with opioids on their own. So is there a way to make surgery and anesthesia safer? Well, I wouldn't be here with Karma if there wasn't a way. Let's start with kids and IVs. Let's start with the IV. Many patients are actually more afraid of the IV than the surgery itself, especially kids. I don't blame them, because I wouldn't want to have a needle jammed in my hand either. Ouch! Well, unfortunately, if we can't get the IV in kids, we have to give them powerful sedatives just so they can tolerate the IV. Now, kids still have developing brains. Giving them powerful sedatives like Xanaxes and medications like that may have side effects that we don't know about. So if we have any options, we try to avoid those strong sedatives if at all possible. So the fact that dogs can help kids tolerate IVs better is great news. Kids also have to go to the dentist. And it turns out that having a dog and a dentist can help reduce distress in kids as well. Same deal. Less stress, hopefully less meds. And in kids with the developing brains, another win-win. Kids can also wake up faster and with less pain after anesthesia when they have a dog. Same thing as before. If kids have less pain from having the dog with them, then less need for those strong medications like those Norcos and Percocets that I wouldn't want to have to give a kid unless I absolutely had to. It's not only kids who can benefit with dogs after surgery. Adults who have joint replacements, think of like new hips and new knees, can do their physical therapy better when they have a dog, and they actually need less morphine than they would otherwise need when they were doing their physical therapy. Physical therapy after surgery hurts, so you need some sort of pain medication usually, but a dog can help replace that morphine that you would ordinarily need. Once again, less meds, less opioids in particular, less chance of opioid addiction, and less chance for opioid epidemic getting worse. All that from a little doggy with no side effects like that. Absolutely incredible. Why do dogs help us with surgery and anesthesia? Well, we don't necessarily know all the answers why, but we do know that they can help reduce anxiety, pain, stress, particularly in the nastiest diseases like cancer. So likely from the mental health benefits that dogs give us, which have very real physical health benefits, they can help make us safer before, during, and after surgery. So doggies can make you safer for surgery and anesthesia? Well, now you better believe it. It's probably because they can help so much with our mental health, which is one and the same with our physical health, all without medications or their side effects. But you've probably never talked about it at the doctor's office, have you? I want you to know how to not get trapped with pills and the opioid epidemic, and to learn the untold medical secrets you should know to take control of your health. Dogs are just one of the many ways, but they're awfully cute at doing it. Well, it turns out dogs can do even more. They can save you boatloads of money. We'll talk about that next time. Until then, remember, you have more control over your health than they want you to know. Karma, that's you. Karma, that's you. Why do dogs help us so much? You.